thanks. And Cheryl, thanks for inviting me today. So a little just briefly on my background. So I'm an engineer by training, like some of the folks on the call today or on the conference call today. But I went into medical device sales early on in my career, but very early on in my career, I gravitated to startups. So for the last 15 years, plus years, I've had my own consulting firm, working with medical device, life sciences, specialty CROs, healthcare IT. Kind of the only space in healthcare medicine I haven't worked in is in the commercialization of pharmaceuticals. And then the focus of my career for 25 plus years has been bringing new products, particularly innovative, disruptive products to market. So, the topics of customer discovery, or what we used to call primary market research, and going to market with new products is kind of my sweet spot and my happy spot for working for my professional work. So Maria and Cheryl asked me to talk about just some customer discovery work, and there's kind of two parts to the conversation, and frankly, I'd much rather do these face to face, but at the beginning, I'm going to kind of talk about the problem behind, of why we do customer discovery and some of the challenges of bringing innovation to market. And then in the second half of the presentation, I'm going to kind of go into nuts and bolts and walk through, how I do my customer discovery work, and kind of a step-by-step for those of you that are going to be doing some of this type of work. At least, but again, it's going to be pretty high level because we have a very short time. I've done these talks over 3-4 hours. I've done them over two-hour sessions. We've designed a course to do it over 8 to 10 weeks, potentially. So what we got, we'll cover as much as we can in an hour. Before we get into that, I'd just like to get to know a couple of people on the phone call, a couple of participants. If anybody wants to kind of raise their hand and just jump in, and if anybody's done any customer discovery or primary market research, share what some of the challenges you might have had that you might want to learn about. Or if you haven't done any of that type of work, just share what you want to get out of the phone call today or out of the conference call today. Just love to hear from 2 or 3 people. And when you jump on, just introduce yourself, what your name is, and then kind of what you're studying at UNC. I know there's some Pharm Ds on the phone. Maybe some biomedical engineers. So just a couple people, just jump in real quick. Anybody?
I can do it.
Go ahead, Eric.
Oh, my name is Eric Anderson. I'm an ICU nurse over at Wake Med. Been there 7 years, ER and now ICU. Went to Carolina for nursing school. And in a couple weeks, I'll be back for the UNC-NC State Joint Biomedical Engineering Master's Program. So looking forward to do some medical-related innovation, entrepreneurial stuff into the future.
Okay, and what do you want to get out of the call today, Eric? Or have you done this type of work before, and what challenges have you run into?
I've never done anything like this, so I kind of trying to build up my repertoire of knowledge in the early startup phase, just so I can try to navigate things a little bit more easily as I come to them.
Okay, great. Anybody else want to jump on and introduce yourself real quick?
Hi, I don't mind introducing myself.
Okay, hey, Michaela.
Hi, I'm Michaela. I'm going into my 3rd year of my doctorate program for biomedical engineering in the joint program of UNC and NC State. And I have done a little bit of this. I do a part-time internship for a startup here in Durham, and it's for a neurostimulation device, and just looking at the customer base that would potentially use that, and we've developed a primary discussion guide to kind of identify the market for that device, and we are in the process of actually thinking a little bit more about it. But so I have a little bit of experience with it, so I'm looking forward to hearing a little bit more about the actual primary research involved with it.
Is there any particular challenges you guys have run into that you're struggling with?
It was interesting to actually develop the primary discussion guide. So it went through multiple iterations to figure out, to make sure that we were asking the correct questions, and that the questions that we asked would actually generate the answers that we needed to figure out what we're trying to find out.
Yep.
So that was probably one of the most challenging, I guess. We haven't actually done we haven't asked any questions yet, or haven't had any conversations with people yet. We're in the process of doing that, but it'll be interesting to see how our discussion guide evolves after we have those conversations, and etc.
I'm glad to hear that it's evolving already and you expect it to continue to evolve. So maybe one more. Anybody else want to jump in real quick? Thanks, Michaela. One more? Anybody? Okay. Okay, if not, we'll just kind of jump in. But thanks, Eric and Michaela for volunteering there. So, first thing, this is one of my favorite quotes, well, as an early stage investor, the one thing I know is that your revenue forecast is completely and totally made up. You have absolutely no idea where your top line is going to look like. This comes from Brad Feld, who's with the Foundry Group, and this is so true. And the more disruptive and the more innovative your product is, the more this is true. The more it's a me too or a product extension, the more you can use historical data. But if you're bringing something disruptive in the market, this is true. And it speaks to kind of what Michaela was saying earlier, is that you've got to be iterative and you got to be learning and adding to your learning as you go along, because the truth is you don't know a lot of the answers. You don't even know a lot of the questions to ask going in. So the other thing is, and here's kind of some of the facts out there, and it's, if you go through this, it's kind of pretty dismal, or it's sobering, I guess is probably a better way to put it. But 90% of starts fail. That's kind of common out there. We hear that, but what we don't talk about are some of this other data. One is most of them fail, 90% plus fail because of market development issues, not product development issues. We'll talk a little bit more about that as we get into the problem. And then there was a study that came out of the Startup Genome Report a couple of years ago. This is out in the technology area, but they found a common factor across startup companies of where they struggled and what caused failure. And in 70% of those failed, in the companies that failed, they did something they call premature scaling, or they scaled prematurely, and they scaled in two areas. One is they scaled the product too early and too much, hence some of the recent work in the last 5-10 years around building MVPs, minimum viable products. But the other area, the most common area they scaled too early was sales and marketing area. And there's a lot of reasons, and a lot of it comes around the companies act like they're in an execution mode when they're still in customer discovery mode. The other thing that, and then some of the other data is, so 75%, this one shocked me, of VC-backed companies don't return the capital investments. So that's the best of the best, the most highly vetted companies out there. You still have about a 1 in 4 chance of being successful going forward. And then this is some data that came out of more established companies, but only 14% of new products in established companies are innovative, but that same 14% generates 61% of profits. So if we can make any small incremental improvement in the success of bringing innovation to market, it will have a huge impact across the board. And when we look at, if you kind of look at the company development cycle, all the problems and all the challenges, they focus in on one particular area, and it's not on the product development side as we started, but it's in this early stage of market development. And it's the stage from, and in the life sciences world, from when we get FDA clearance, we can actually start selling a product, to when we get the scalability. It's going through this learning stage, this iterative learning stage is where the challenge lies. And in healthcare, so that's kind of, if we go back, this is kind of in general. This is true for any markets. A lot of this data comes out of the IT space and other spaces. But if you look at healthcare and life sciences and medtech and digital health, it gets even more complex, because when you're looking for product market fit, we have a much more complex marketplace than most markets. And when I say much more complex, if you just look at who the customer is, who is the customer? You've got payers involved. You've got the actually clinicians that are delivering the care involved. You got the facilities, as in clinics and hospitals are involved. They have the patient. So who becomes a customer? And the answer to the question in many places is you have multiple customers and multiple decision makers. And in the healthcare field, it becomes even more complex. And then you layer on top of that the complexity that's added with reimbursement, Medicare and insurance companies, as well as regulatory. You've become this figuring out what the value proposition and the customer discovery and how the purchase decision made and how the adoption of a technology into a facility is used and how it gets ultimately delivered to the patient at the end of the day. It becomes extremely complex, and the more complexity, the more we have to dive into understanding it. And this is one of the fundamentally here, this is the reason we need to do this early customer discovery work and understand what's going on. And by the way, if anybody has questions as we're talking along, just sort of raise your hand or stop me or speak up, and I'll be happy to answer as we go here. And as I look at medical device and medtech and life science products, there's some fundamental building blocks of what you have to build a successful company. And these are, if you break it down, these are the areas. So you've got, the intellectual property piece, you got the regulatory piece, you got the product development piece. Then you've got the payment piece around reimbursement and how it's going to get paid for, and then you have the market development piece. But as we look at in many startup companies, you'll see this as you're working with companies. This is where, on these three areas, the intellectual property, the regulatory, and the product development, that's where we spend the large percent of our resources, both our time and our capital, early on in customer development. But or in the company development, but if you look back at what I was talking about earlier, where failure lies, the failure actually lives in these two areas, which are the two areas we tend to spend the least amount of time up front on in companies, or spend the least amount of resources. These two areas, so when I'm advising companies, when I'm talking with companies, I tell them that these are the first two things you need to address. You shouldn't spend any time on the other issues until you get at least a sense and an understanding of whether there's a framework to build the company or the product around based on these two areas. And the two areas being how, if I bring this product to market, is there a critical need that I'm addressing that people will change their behavior to adopt? And then the second piece is, can I get paid for doing that? We're not going to go into the reimbursement piece in this conversation at all, but I will tell you, I've run into situations where you have huge critical need, and you talk to all the players in the decision process, and they'll agree with you. We need to solve this problem. It's costing the system a lot of money, but because the way the reimbursement is set up, sometimes there's no path to revenue. Even though the need's there, the cost is there, the direct impact is there, because of the convoluted reimbursement system, you can't get paid. One area I saw this was with in the diabetes space for getting vascular access, where they had separated out where the dialysis was being done to where they were getting their vascular access delivered. And because of how they separated out the reimbursement, they had this huge problem that's costing millions, tens, if not hundreds of millions of dollars. But there's no way to get paid to solve that problem, which basically kills the product in the short term. So I'm belaboring this one a little bit, but these two areas are the two areas early on you have to pay attention to, because these are the two areas where failure lives. And the other thing I'll say about this slide is that in these areas, I would call these areas, there's uncertainty around regulatory, there's uncertainty around intellectual property, there's uncertainty around the product development, but a lot of times you can capture that uncertainty and quantitate it to some extent. or graded. In these two areas, you live in the unknown a lot of times. So when you're bringing disruption to market, when you don't know what you don't know until you actually get to that stage in the marketplace. And so it's the difference between the uncertain versus the unknown that you're dealing with here. And you want to drive as much of that risk out early on as you can as you're developing a company. So here's I'll just tell a couple real quick stories. So a friend of mine worked for a local device development company, design and development company, contracting, and he brought me a product that was already in sterile wrap. So this product had been developed. The founders had spent like $3 million of investors' money developing it. And what the product is, it cleared out suction in the OR suite, so suction tubes. And they had raised $3 million. They had run out of money. They had brought it to my friend and say, "Is there anything we do with it?" He says, and he brought it to me. I said, "Tim, I have no idea, but let me go talk to a nursing supervisor in the OR." So contacted made a couple calls, got a chance to meet with the OR supervisor at UNC Hospital, met in the Children's Hospital lobby. If anybody's been there, it's where that sculpture is that makes all the ringing and the balls dropping and the teeter-totters there. And we met outside there. I showed her the little sterile device for clearing these suction tubes. She goes, "Chris, here's how we solve that problem today. First of all, when a suction tip gets clogged, the surgeon's frustrated when he hands it back to the scrub nurse, and he basically throws it at her and tells her to fix it because he can't see the visual field. She takes a 5-cent replacement tip, pulls off the old one, throws it in the trash, pops on the new one, and if she doesn't hand it back to him within 3 seconds, he's screaming at her. That's how we solve the problem today. If there's anything that's going to slow that down, it's going to cost us any money, it's pointless. Well, for one interview with one OR supervisor would have saved $3 million in 3, 4, 5 years of development on that product alone. So these are the, and those are the simple stories that solve it. This is another one of a local startup that did an induced hypothermia product. That means that you after a cardiac event, you drop the blood, the internal temperature of the patient by putting in cold fluids through an IV, and it helps preserve the damage to the tissue post cardiac event. Well, they had developed the product, had raised $1.3 million of local money to do it. And here's if they had done a little bit of customer discovery work up front, the current solution was, and they were bringing that from the hospital setting to the ambulance setting. Well, ambulances were already doing induced hypothermia, and how they solved the problem is they went to Costco, spent less than $100 buying an electrical cooler, a 12-volt cooler that you plug into a cigarette lighter in the ambulance, and they just threw their saline in there. When they had a cardiac case, they grabbed the bag of saline that was already cooled down and they infused it. So it was a one-time cost of $100. And they were talking of, they come up with a solution that was probably was kept colder longer and maybe even drop the temperature a little quicker, but it was going to cost multiple hundreds of dollars per usage. And in ambulances, the margins are so tight, they don't put anything on the ambulance. It's going to be discretionary use because they'll be losing money doing it. So here's another device that was developed, took through all the R&D process, it got the prototypes, it spent $1.3 million, and a little bit of customer discovery that we had done 3 years earlier and passed on this idea would have eliminated all of that. So here's another quote, and the reason I put this up, I'll tell you in a second, but the common wisdom was wrong. And a startup success isn't just about execution, it's how well we take our original hypothesis and learn, discover, iterate, and execute. And that's from Steve Blank. And I'll pose it out to you guys. So how well we take our original hypothesis and learn, discover, iterate, and execute, what does that sound like? To the scientists in the room, that's basically the scientific method. And that is fundamentally what the framework for going through this early work. And I share that quote here today because the framework for doing this early work is what many of the folks already on the phone are very comfortable with. It is a scientific method. Just like you have a hypothesis around the experiment for a scientific experiment, we have a hypothesis around what the market experiment is. We think we know what the problem is. We think we know what the right solution is. And then we think we know who the buyer is. We think we know how they're going to respond to our messaging. And we develop a hypothesis, and it's truly a hypothesis. And then our job is to test that as quickly and as efficiently as possible and go through that process to figure out what is true, what validated and invalidating what our hypotheses, but also at the same time identifying what we don't know already, having discoveries along the way based on hypothesis. And the goal of that is to get to a repeatable process that we can then execute and scale a business around in the marketplace. This is exactly how many of you guys are trained to work today. So this is a very familiar framework for you to work from. Actually, frankly, most sales and market development people don't know this framework and aren't comfortable transitioning to this. I did a project for Marae and one of the startup companies out of UNC recently, and I worked with a PhD, and part of the way into the customer discovery process, the light bulb went off when she kind of got that this was so familiar to her. So I just give you that to share with you that for many of you, this is a familiar framework to operate from. That's a little bit of background on customer discovery, why we're doing it, why it's so important, why it's missing in a lot of places, and how critical it is. And I'm going to jump into, basically walk you through the nuts and bolts of how I do it. Does anybody have any questions or comments or thoughts they want to share at this point in time? Okay. If not, I'll keep moving. Again, jump in and ask questions. I'm probably talking too fast. I'm going to slow down a little bit, but I want to make sure we get through this and leave some time for conversation at the end. So here's a chart that I pulled up found some research a couple years ago on how many conversations or interviews you have to identify all the needs of a particular customer segment. And if you look at kind of the sweet spot here is somewhere in the 8 to 12, even up to 15 range. But once you get to that point, you pretty much have all the needs identified. I found that these numbers are pretty accurate empirically from the work I've done over the last 20, 25 years. If you're talking to the right people, you kind of need to get in the range of 8 to 12 interviews to really get the data you need to draw the conclusions that you need to conclude at the early stages. And I'll talk about this more, but most of this data early on is qualitative data, as you'll find, Michaela, as you get into this. It's qualitative data. It's not gonna be hard numbers early on because you're trying to get you're trying to assess people's behavior, pain levels of problems they're dealing with, and this to get that. It tends to be qualitative, and instead of looking for hard data from a quantitative standpoint, what you're looking for is patterns across interviews or patterns within the data. And the other thing is, and one of the other things you'll find out, and this comes to your comment, Michaela, and I experience this in almost every time I set up and do one of these customer discovery projects. Early on, you're learning exponentially with the early discussion. So in the first 3-4 interviews, you're learning so quickly that those are then informing how you're interviewing the next interview and the next interview. So the interview even becomes iterative, and you're discovering things as you go through it that you then want to test throughout the rest of your interviews. And then when you start getting into the 4, 5, 6 range of your interviews, that's when you start distilling out some of these patterns that you want to then prove out through the rest of interviews. Um, as as Maria alluded to earlier, when we were working with Steve and then the pre-cinch technology, in the first 4 or 5 interviews, in the first couple interviews, I started hearing this. Well, we pivoted actually in the first couple interviews, because the original hypothesis was that the need sat in the oncology, in the adult oncology market. As we interviewed them, I started hearing that there wasn't a strong need there. But what came up in a couple of the first interviews was this potential need in peds. So as we were doing those interviews, we then started adjusting the interview questions, the interview guide, to continue to explore that arena, and to see if to validate or invalidate some of that early qualitative data. And that's what, as Maria alluded to, that's what as we went through that data stayed consistent, both on the adult oncology market, but also for the peds market. And that was one of the major pivots and conclusions out of that data. But this is kind of how many you need to talk to. So how do you go about doing the customer discovery? And so there's different ways to get market data, and these are kind of the three most common ways of doing it. What I would call one-on-one interviews, surveys and questionnaires and focus groups. And we could go into these, but we won't go into them. There's really only, in the early stages, there's only one that matters. Surveys and focus groups are absolutely useless for doing this early work, for a number of reasons. One is, with surveys and questionnaires, it's assuming you know what the right questions you're asked to ask, and you know what the right answers are. And by definition, if you're going to market with a disruptive, innovative product, by definition, you don't know those. And that's why it's a scientific method versus an execution stage. And then there's all sorts of issues with focus groups, but both surveys and focus groups, they have their purposes, but they're not this early stage. At this early stage, you've got to be doing interviews. If you can, you want to do them face-to-face. By phone or by conference call, that works as well. It's, and kind of when I do these, I really try to do a couple of my first interviews face-to-face. And then once I get a little more comfortable about and get a little better design around how the interviews are going to go, then I transition to phone. I've done some of these where I've had to do all of them by phone because we just didn't have a travel budget and couldn't do it that way. And that works well. It just doesn't work as well as face-to-face. And we'll talk about this a lot more as we go through these, but you got to be careful about how you design the interviews and conduct the interviews, because you can introduce a lot of interviewer bias into the based on how you actually conduct the interviews. And this is even more challenging when it's a founder that's conducting the interviews. I did one, and I won't do this again, and I don't do this anymore, but I had one where the founder came along with me, spent the first 15 minutes of the interview talking all excitedly and all passionately about the product they had developed to solve a problem, and talked about the problem as they thought it. But as soon as you do that, you then bias the interviews. So now sometimes I will take founders with me, but I coach them before we go in and on how to conduct the interview, and then I will lead the interviews and that type of thing. There's reasons to do that. We really don't have time to go into that today of why you would want a founder in the interview, but you got to be careful about how you conduct them. So this is what I'm going to walk through real quickly with you, but these are the steps I go through when I'm doing one of these customer discovery products, and this is getting into the nuts and bolts. So you identify the KOLs in the life science and medical world are key opinion leaders, if you don't know what that means. And so you identify the people you want to talk to, and then you figure out how to target them, go after them. The second step I do, and that's kind of the first gauging step, kind of in parallel with that, I'll be developing the questionnaire. And actually, I don't call it a questionnaire, I call it an interview guide now, and I'll talk about that as we talk about the interview guide. Then I develop my materials for the outreach. Typically, it's just an email. Sometimes it's a small support presentation, but I try not to do that. Main reason is we're not really pitching a product solution in these early interviews. We're trying to understand the problem we're addressing in a deep way. So I try not to do that, but sometimes you have to, and it depends on the stage of the company. And then you just got to do all the heavy lifting and the work to reach out to people. And typically, I'll reach out to people, in multiple platforms, but most of the time it'll be through email. And this is just, heavy lifting. Email, I'll typically do an email, make a phone call or leave a voicemail 2 or 3 days later, follow it up 2 or 3 days, maybe up to 5 days later with a second email. And then I'll do a phone call after that. Typically, I'll do that 3 times at most. And then beyond that, I don't reach out. I have a couple tips in this presentation. This is my first tip. So one of the things I've learned out over the years is I'll be doing a sequence of outreach, and I'll do an email, a phone call, an email, a phone call, and then my final email is what I call my takeaway email, and it'll sound something like this. Hey, I really want, we type this up so it's cleaner than this, but it'd be something like this. I really wouldn't be bothering you, except for I think you might be really interested, and I'd love to talk with you about this because I think it's a good fit around what you're doing. But I don't want to become a pest. So this is the last time I'll reach out to you. Can we set up a time to talk? But I promise not to reach out again. And I've got just as much response, if not more response to that email over the years than anyone, because it shifts the responsibility. I think this is what's going on. I haven't interviewed anybody to find out, but I think what ends up happening is when, if they've had any thought of talking with me about this, or they have any interest in what I want to talk to them about, and I say I'm not going to reach out to them, it shifts the onus on them to respond. So that's my first tip around, tricks of the trade on what to do. This is one thing I do at the beginning of every project. I lay out a project plan. To do a complete customer discovery and do 8 to 12 interviews, it's probably an 8 to 10 week project on average. And I detail it out very carefully. You'll see inside the red lines, most of the work is doing the outreach and doing the interviews. One of the things I do very carefully up front is I identify exactly what the objectives and the goals from that work are going to be. Because I want to know exactly what questions I'm trying to answer. What's the most critical question that needs to be answered? 9 times out of 10, when I'm doing it with a customer at this early stage for innovative disruptive products, it's understanding the problem that needs to be solved that we can then address and solve. Similar to the story we talked about with Steve and Precinge. The problem didn't live in adult oncology. The problem that the customers were having around the precision and dosing lived in the pediatric area. So, 9 times out of 10, it's always around the problem. And then the other thing I'll build into it, I'm never selling during these, and I'm never pitching during these discovery products, but I'm looking for what I call market pull, or people that want to be early customers of the company. And it might show up in the interview. I'm talking to a surgeon. He might say, hey, listen, do you guys have a chief medical officer? I might be, if not, I'd be interested in getting engaged with the company. Or it might be something like, hey, do you guys need to do clinical trials? I would love to be one of your first sites. Or it might be even as bold as, how soon are you guys going to be ready to sell this product? We'd want to be an early user of your product. But I'm always looking for that type of engagement in these interviews, because that type of market pull oftentimes tells me more about the need in the marketplace than oftentimes what I'm hearing from a customer. So I'm looking for that to come out of these discussions. Questionnaire, and I've changed the term. This is an interview guide. It's not a questionnaire. I'm very precise about my goals and objectives. So I want to be clear about what and the other reason for putting it is I make these completely exhaustive. Everything I think about asking, I put down, because one of the other goals of the interview guide is to free me up from thinking about what I want to ask a customer or what I want to ask them on a call. It frees me up to completely listen. And if there's anything you hear from me from this, that's probably one of the most important points, is your job during all this work is to listen. And as Maria said, sometimes it's, you're, when people don't have that approach, and I had a friend call it, they listen with happy ears. They listen with only for what they want to hear, and any evidence of that. And this is particularly challenging for founders, and I understand why. I haven't, when I'm doing my own work for my own business for that, I find it challenging myself, and I have to true myself up. But you're truly at this stage, you're looking for the good, bad, and the ugly, because you want to know everything about your customer and how they're going to respond to the problem and the solution you're offering early on. The earlier on you get it, the more informed you'll be, and the better you can pivot or make changes. The further you get down the path from product development and company development, the harder it is to change what you're doing. The questionnaire, it goes from general to specific. As I said, it's clear and complete. Very important, you teach yourself and you write them down as open-ended questions, not yes or no, or not options questions. How, what, why are your key words in all of these. And then there's a good rule. There's a good rule around how do you get to the core cause. Ask 5 whys. Someone says, you ask them why they did that, and they say answer 1. They say, okay, so then why was that? And you keep driving deeper. So these open-ended questions are really important. The other thing is that I use it as a guide. I've done some interviews where I've only asked 20% of my questions, but the interviewee took me down a path that I didn't even know to go down, that opened up a whole new world. For instance, and we talked, going back to Stephen and Precinge, that's the pediatrics was we didn't know to ask about pediatrics when we started doing those interviews. That came up, and because it came up and we were open to go down new paths, it opened up a whole new opportunity. So these are guides. And then I've done other ones where I've done, where I've covered 80 to 100% of the questions. It's very infrequent that I actually cover 100% of my questions in an interview, because most of the times I'm interviewing a surgeon or a physician, and I have limited time anyway. So, but again, it's a guide. It's not a script. And the other thing, and we talked about this a little bit, most of the time when I see people talk about the value proposition, they get to that stage, they start talking about the features and benefits, and they ask about the features and benefits. At the early stage, that's not the critical question. The critical question is understanding the problem as deep as you possibly can, understanding as deep as you can from the customer's perspective, in their language, in their world, because that's what you're addressing. And the more acute the problem, the more critical the problem, the more higher up is on their list of problems they deal on a daily basis, the better chance you have of entering the market and actually getting early sales. So that's the primary thing you're looking at in all these interviews, is not test out your features, not test out the benefits you're solving. It's getting to the core of the problem that you think you're going to address and that you want to address that you're trying to solve. And that problem is pervasive. It's the first question you ask, and it drives everything right on through the whole from the development of the product all the way through to your sales at scale. That problem is the driver of everything. So it's a thing you want to focus on early on, and get your head wrapped around. I'm not going to go in this, but this is my sample question. This is a sample interview guide. This is images of an actual interview guide. It's pretty pervasive. It's complete. My typical interview guides are 2.5 to 4 pages long. I'll start with the goals. I'll ask very general questions. I'll start most interviews with questions around, if I'm talking to a surgeon, I'll be asking them, how big's your practice, how many procedures you do, very general questions. It allows things to warm up, it allows things to get people to comfortable. But then I'll just ask really open-ended questions. And this is a typical one I'll ask them. What are the top 3 critical issues you deal with on a daily basis? I don't want to bias them. I want to bias them as little as I can getting into it. And I want to see where their head goes immediately around the challenges they have on the day-to-day, and is it anywhere near. Okay, Cheryl, thanks. I'll try to wrap up here as quick as I can. We're getting close to the end. I designed the interview guide. Now, that doesn't mean by the end of it, I'll be asking very, very specific questions around the specific value proposition, the specific problems I'm solving, the value I think I'm generating I'll get into financial questions, cost questions, buying questions, and I'll try to cover everything, but I get very specific towards the end. But early on, I'm looking to be very general and to not bias. This is a really important piece of how you design these interviews and how you conduct these interviews to get the data you need at the end of the day. I'm going to just go through this real quick. This is a sample email. This is a pretty old one. My emails typically are about half this content. Most important two really important things. One is the most important line of this is the subject line, okay? And it needs to speak to the problem. Doesn't need to speak to the product or the solution. It needs to speak to the problem you think you're addressing. And then the other important thing is to keep it short and sweet, and make the ask. But you just want it to be clean and quick. We're running out of time. I want to leave some time for Q&A. So let me see. So the rules of the interview. So a couple things is use the interview guide as a guide and refer to it so you don't have to think about what you're going to ask. So you want to be present and you want to have your complete attention on the customer. You want to listen. I start off every interview with confirming the time I've asked for and how much time they have. This is a little trick. I'll ask for 45 minutes knowing that if I ask for 30 minutes, I'll only get 30 minutes. If I ask for 45 minutes, 9 times out of 10, I'll get an hour. So I normally ask for 45 minutes and usually you get an hour. The other thing I do, and this is probably the best tip I'm going to give you today, and I've only started doing this the last couple of years. I call it the right of refusal. And I start every interview I do now with a statement like this. Dr. So-and-so, I'm not going to pitch you or solicit anything. This is purely a research based interview. But I'm going to ask you every and any question. And if you're uncomfortable answering any question, just tell me you're uncomfortable. We'll move on to the next. This builds trust and credibility up front, but it also gives, and it drops their guard a little bit because they now have the right to refuse. They don't have to be uncomfortable telling me they don't want to answer a question. But the most important thing does, it frees me to ask any question. So I can ask competitive questions, pricing questions, buying questions, and it completely frees up the whole interview. It's probably the best tip I'll give you today. And we talked about most of these. Probably the other thing that's most important here is listen to be surprised. You want to design your interviews and you want to listen to your interviews to learn things that you didn't know going into that interview. Some of the best interviews I've done, I've only asked 20% of questions and opened up a whole new opportunity for the company. And the most common mistake I see during interviews is people pitch their ideas instead of listening and learning and hearing the good, bad, and the ugly. And this is pretty much the second to last slide. We'll wrap up here in a moment. So this is really, really important work to do at the very beginning of building a company around a disruptive innovative product. It should be the very first thing you do, is to understand the problem from the customer's perspective. But that's just the beginning. You need to continue this understanding and discovery around the customer throughout the whole company development process. So this is just the beginning. What you do early on just leads to the next discovery. And the third tip I'll leave you with is one of the things I see, the biggest mistake I see people make is they spend too much time planning and not enough time talking. Spend a little bit of time prepping to do this. You need to do your diligence to do it, but spend a little bit of time, but get out there and talk with people and engage with people. That's where the value of all this lives. And that's it. So I think we have what, maybe, yeah, about 10 minutes if we have any questions or comments or thoughts. Come on, there's got to be a couple at least.
Chris, why don't you tell them a little bit about, kind of like phrases maybe when they start talking that kind of lead them to do the quote unquote wrong questions, kind of like things to kind of like avoid when you were mentioning a few, but common mistakes when they're starting the interview, and that kind of leads to them talking about their product or other things where you kind of in a way bias that conversation.
Yeah, so a couple things around that. One is getting trapped, and Maria, this happened with Rima a little bit, and she learned as we did the conversation, but getting trapped to talk about your product. So we'll start an interview, and one of the things you have to do at the beginning to get their attention, you have to tell them a little bit about what you're doing, because you got to tell them a little bit about the solution to get the interview with them, basically. And they'll ask you a question around the product, and you'll get trapped. And the way you want to handle that early on, say, hey, so doctor, I appreciate your question, and I'll be happy to answer all your questions about what we're doing and how we're doing it. But what I'd like to do is learn a little bit about you and your practice before we actually go there. Is that okay with you? So it's really, that is the biggest trap, is to get talking about what you're doing. And even if you go in with the best intentions, you get trapped into it, but resist it. That's number one. Number two is, the other piece of advice is filling silence with you opening your mouth. So when you ask a question, just be quiet. And sometimes the silence will get a little bit painful. But what seems like a long time typically might only be 3 or 4 or 5 seconds. But but that's the other thing, is ask a question and then give the interviewee time to answer the question. And a lot of times they're just thoughtfully thinking about it. But that's the other thing, is be comfortable, or talk to yourself before you go into the interview about being comfortable in the silence a little bit. Those are two things that come to mind. Do you have anything else? Do you have any thoughts around that, Maria? You might have.
No, I agree with you. I think that being able to let the other party answer it's certainly a very important quality to gain, and like you mentioned, kind of stalling to tell anything about the actual product in itself. Is again, you're trying to identify those pain points, how they would actually use that, and it's important to let them talk and understand how they go about the process of using technologies that either compete with what you're trying to create here, or
the other piece of advice I would suggest is trust your interview guide. When you're not sure what to say next or do next, just I've even been in interviews where I've said, hey, listen, just give me a second to look over, see what I haven't had a chance to ask you yet. And I'll take 5, 6 seconds or even 10 seconds. It's kind of gather myself, look down, and trust your interview guide, because that's what you designed it for. You designed it to get you quality information out of the interview. So trust it. That's what it's there for.
So one of the things that I think is ideal in this situation, providing you with this information, is that you as a student working on behalf of a venture that may be doing these customer interviews, there's so many advantages there from the standpoint of, one, you're a little removed, so you don't necessarily have that passion and, from that innate passion about the product and that connectivity yet to the product. So you're not going to necessarily get, fall into the trap of talking too much about the product. I think that that's one of the things that I see as far as an advantage to having a team like you support a startup in this area. Plus, you won't lead them down the path of, isn't this so great, and those kind of positive type of affirmation statements. I also think that the final thing is the fact that you're students and you're doing research and you're doing this on behalf of a startup, I think is also really helpful, and kind of maybe takes the guard down of those interviewees. They don't necessarily have to worry about hurting your feelings about the fact that they don't like this product, or that they're going to give some negative feedback, because you, again, as a team, you are not necessarily going to be negatively directly affected by that. So I think that those are some of the positives and some of the reasons that I really love the idea of a team like this consulting on behalf of a startup and doing some of the customer discovery. It's important that the startup person hears it on his own too, her or him, his own. But I do think it's a great opportunity to get some real good data.
Yeah, Cheryl, I think that's really good. I think two things that I just add to that. One is this is the time you want to get the bad information or the negative information around the market and your product and the problem you're solving, because this is the easiest time to address it. So you actually want to pull those out. You don't want to focus on, but you want to pull that out. The other thing is, when you're doing your outreach, leverage that you're a student doing it. I have found that, especially physicians, they might be more likely to respond to you as a student at UNC doing your MBA or your biomedical engineering than they would to me as a business professional reaching out to them. Because I would, when you reach out to people, leverage that. Don't overplay it, but just tell them exactly who you are and what you're doing. Because I think that'd be helpful as you try to set up these type of interviews.
I have a quick question. First off, thank you for your talk. You provided a lot of actionable advice, which I appreciate. So you talked about the building blocks of medtech products, and you identified the market and the reimbursement were really important. And throughout your talk, you really indicated good ways of discovering those customers and that market aspect. Would you apply a similar approach towards the reimbursement and identifying that pathway, or would you identify or use an alternative approach? So kind of talk about a different topic.
That's a multifaceted question and answer, Michaela. So at a very fundamental level, from reimbursement, you got to figure out where you fall. So are you in a DRG and or are you fee for service right now? Is there a reimbursement code already for you? Or do you have to go get a new reimbursement code? Are you going to go direct to pay? Are you going to go patient pay, or are you going to go down an insurance pay path? So there's some fundamental buckets you got to kind of figure out where you play in. So I have a client now that is that's selling a solution in the hospitals, and they're in the DRG space. So there's not going to be a reimbursement code for what they do. So they have to compare to the existing cost of doing that procedure. Now, if you're doing a new surgical procedure with a new device, and it's a whole new surgical procedure, and you have to develop a whole new reimbursement code around that, that's a whole different ballgame. There's there's a fair amount of companies, that it depends on the specialty space you're in, that are now starting to do patient pay plays and avoiding insurance in the insurance arena completely. And there's some reasons maybe to go down that. So you got to kind of figure out where you fit in from at a high level, and then how that strategy builds into your company. So that's one piece. But the other thing is, a lot of times during these interviews, I'll do a lot of questioning around how did these products get bought? What's the reimbursement for? What codes you're using? If I don't know some of those answers, or if I have an idea what those answers are, I'll definitely get those interviews. Now, the problem you have with physicians and surgeons, it depends on the setting. If they're a hospital-based surgeon doing hospital procedures, a lot of times they just have no idea. But I will always try to get as much information I can out of these interviews as possible. Does that help answer your question? Okay. Give me a
Yes,
thumbs up.
thank you.
Okay.
Yeah, absolutely. That answered it. Thank you.
But reimbursement is a very convoluted, challenging thing
Mhm.
in healthcare. But you've got to it's really, so the two failure points and the two highest risk points for all med tech companies are marketing and reimbursement. So that's where 80–90% of the failure is going to live for these companies. So you better get as best you can, wrap your head around those two things early on.
That makes sense. Thank you.
Yep.
Great. I think we have maybe time for one more question. If people have that, anybody?
A quick question.
Sure, Cody.
Thanks. So you had mentioned you're kind of targeting 8 to 12, maybe 13 or 14 kind of good quality interviews.
Yep.
Kind of what kind of a success rate does that look like for how many people you originally kind of look out to seek? And then is there kind of a quote unquote success rate that you might look at that's too low? You might reevaluate your opening pitch.
Well, yes. So there's a couple questions. So give you a ballpark. If I'm targeting 8 to 12 interviews, I start with usually a list of 40 to 50 outreach contacts. And usually, and the most important part of the outreach is the subject line. And in the subject line is the problem you're going after addressing. That's what you've got to get their attention with. So that's always, if I'm not getting a good response, that's the first place I'm going to look at is it not really a real problem? Now, what will end up happening is if I'm getting a lower success rate on contacts, I'll usually get a couple interviews. I'll be able to start teasing out those answers in those early couple of interviews. So I think that's the other thing I will say is, I'll reach out to a block of people, and depending on that response and how that response, I'll always be adjusting my outreach and my interview guide as I'm going through the process. But yeah, and a lot of times, and the other thing and this is unusual, this is not common, but I've never have, and I don't offer upfront honorariums. I don't know if you guys know what an honorarium is, but typically when you're trying to set one of these up with a medical professional, a physician or a surgeon, usually you pay them for their time, anywhere from $250 to $500, even upward $1,000. I've never offered that. Frankly, I think it biases the data. I think a lot of times big companies do that, and they reach out to people they know already, which biases the data even more. And one of the things and what I will tell you over 20 years of doing this, if you can't reach out to 50 docs with your problem and get interviews with 8 to 10 of them, you're not addressing a problem that's important to them. That's probably the biggest takeaway. So you have to either rephrase your problem more in there that hits home, or you have to pivot. Is that helpful, Cody?
Yeah, that's great. Thank you.
Yeah. But the other thing I'll say on that note, just briefly, Cody, all of this early on is the scientific method. It's iterative and it's learning. So that's kind of at a broad base, at a fundamental base. That's what you're doing throughout the whole process early on. That's even after you go to market for the first year or two, or maybe even longer.
Thanks. Chris, can we share the slides with the rest of the group?
Sure. Happy to.
Great.
So, should I send this to you, Maria, or Cheryl, or both of you? Or
If you can send it to both, that'd be great. Thank you
Okay.
so much.
be happy to.
So again, everybody, we're very thankful for Chris for the great talk. Again, he has lots of experience, and we had a great, experience working with him as well with their startup companies. And we're probably going to be working with them over the fall in a longer course. So we'll keep you posted on that as well, as we develop that, more of a 6 to 8 week course in the fall, to do more, actual case study work with this as well. This is kind of like a nice intro to the topic, but I hope it's also useful. It has a lot of advice and great strategies to start working on this as you go over the summer working with startup companies.
So Maria, quick thing on the presentation I send out, we'll have my phone number and email address. If anybody has just a quick question or they want to grab a cup of coffee, I know we can't do that now. But as you're doing projects and your questions come up, Michaela, as you're getting your reviews, if you have a quick question, don't hesitate to reach out and ask me.
And thank you, everybody. And again, a reminder, if anybody wants to work in the Prestige project with Assure Technologies and Professor Eckel, please, just contact me or Cheryl, and we'll get you in touch with them as well. Thank you so much, Chris. Again, that was a great presentation. Thank you.
You're more than welcome, Maria. Thank you, and Cheryl, and everybody that participated today.
Thank you very much.
Bye, everybody.